Hi everyone, welcome to your vaccine data update for the week. As of June 16th, 54% of Chicagoans have received a first dose of vaccine. That's 33.4% of 12 to 17-year-olds, which is over 50,000 kids, 63.4% of Chicagoans 18 plus, and 70.7% of Chicagoans 65 plus. 1.4 million Chicagoans have received at least one dose of vaccine, and now over 1.2 million have completed their series. What will it take us to get up to 70% of 18 plus Chicagoans vaccinated? It's about 1.5 million adults. And guess what? We only need about over 100,000 more adults to get there. We know there's a backlog of doses out there, which might help us catch up a little. And this is why we requested for all COVID providers to report their doses administered this past week. In order to achieve equitable vaccine distribution, we need good data. Unfortunately, we're getting to the point where gaps in data entry are impacting our ability to make strategy decisions. We can't target resources to the community areas that need them without good data. There are still ongoing problems like current reporting does not capture doses given out of state or by federal entities. While we work on those issues, we'd like you to work on reporting your doses administered. Compared to the rest of the state and country, Chicago is keeping up with every age group in terms of first dose coverage on the left, but is still far behind for 65 plus, with 70.6% coverage, compared to 86.9% nationally. We have not been able to move this coverage, so please email us and tell us why you think the 65 plus first dose coverage is stuck and what we should do. For completed series, on the right, we're doing slightly better than the state and country in every age group, except 65 plus again, at 64.5% completed series, compared to 76.6% nationally. We did see a slight increase in vaccine administered last week, and this was largely driven by second doses administered to 12 to 17-year-olds. An increasing proportion of vaccine is being administered by pharmacies here. For example, last week, CVS had their highest volume week yet. When you look at a breakdown of provider type by age group, it becomes apparent that teens and older adults are more likely to get vaccinated in outpatient offices, FQHCs, and hospitals, while pharmacies seem to be more convenient for other age groups. On the left, you can see Chicago's 7-day rolling average of first doses in blue, completed series in green, and total doses in black. While first doses in blue continued to decline, we did see an uptick in completed series after the first adolescent vaccination surge. And here you can see why. The blue line is the 7-day rolling average of our 12 to 17-year-olds. On the left, the first doses, and on the right, a nice spike in completed series, which is great for our kids and exactly what I was hoping to see. 71% of first doses went to Black and Latinx Chicagoans last week. I'm hoping that this is a sign that we will see a continued steady increase over time to catch up with cumulative vaccination coverage in white non-Latinx Chicagoans. We're seeing an increase in percentage of first doses and completed series in Southwest and Northwest community areas when comparing the week ending June 5th to the week ending June 12th. We're also seeing some progress in first dose coverage in the far south side of the city, so things are changing. Almost all zip codes with the highest case rates last week were in areas where less than 50% of the population had received at least one dose of vaccine. It's great to see vaccines working each week on our dashboard, and that's thanks to our great epidemiologist, Stephanie Gretsch. With an eye on data quality again, we saw that an iCare registry data refresh on June 8th led to a large improvement in completed series. Data quality is important for patients, clinics, communities, entire healthcare systems, and for our ability to reach true herd immunity in this city. We'll keep you updated, and please do your best to help us by getting your doses in. In other news, remember that the Protect Chicago at Home program has been extended. Starting June 28th, all individuals 12 and up will be eligible. So remind your patients, case managers, or social workers to call 312-746-4835 to schedule appointments. Also, don't get rid of your J&J, please. This is a big message this week. The shelf life has been extended to 4.5 months by the FDA. So keep checking expiration dates at vaxcheck.j&j. We're going to take a break from these data updates for a bit, but I want you to enjoy your summer, and thanks again for keeping Chicago safe, one shot at a time.